بسم الله الرحمن الرحيم. السلام عليكم ورحمة الله وبركاته. In this presentation, we will be explore together the topic of scorpion sting in Saudi Arabia and management in ER. This is a significant health issue, particularly in the arid regions, and it become more common during the summer months. Becomes more common during the summer months. The scorpion sting can cause severe complication, especially in the children. Therefore, early recognition and treatment are essential. In Saudi Arabia, over 30 species of scorpions are present. The most medically important are the Androctonius and Illyrius, the black and yellow one. There are many other black and yellow scorpions. Therefore, identification of the scorpion based on its color is not possible. Most cases occur in males aged between 20 and 40, but children under 10 are the higher risk of severe reactions. Rural regions like Qasim, Hail, and Najran reported the highest numbers. Most stings are mild, about 5 to 10% require hospitalization. Fatal cases are rare and usually involve children or the elderly. For pathophysiology, the scorpion venom is mixture of polypeptides and enzymes. The venom consists of neurotoxin, cardiotoxin, nephrotoxin, hemolytic toxin, histamine, serotonin, cytokine releaser. The neurotoxin is the most important content. It can cause severe systemic manifestation like autonomic storm. And cardiotoxin can cause heart failure, myocarditis. Nephrotoxin can cause acute kidney injury. Hemolytic toxin can cause hemolyzed blood. And histamine release can cause allergy. Serotonin, cytokine releaser can cause pain in the site of the sting. For clinical features, depend on multi-factors like extremes of age, female gender, low weight patient with comorbidities, size of scorpion, the season of the sting, and number of stings. Most scorpion stings are minor, producing moderate to severe local pain, paresthesia without systemic involvement. And another sting can cause wide range of symptoms, start from severe local reaction to neurorespiratory and cardiovascular collapse. For venom absorption, the duration to progress the systemic symptom range from minutes to 4 hours after the sting. 70% of maximum concentration of venom in the blood reached within 15 minutes of sting. Almost complete absorption of the venom from sting site would occur within 7 to 8 hours. The symptoms generally persist from 10 to 40 hours. For clinical presentation, we can be divided to local manifestation and systemic manifestation, mainly autonomic storm. The local manifestation stings typically don't produce a visible lesion. Rarely a small red mark is noted. Local pain with paresthesia. We can see also redness, heat, edema, swelling, urticaria at the site of the sting. But the absence of visible puncture mark doesn't exclude the inflammation. The systemic manifestation. For systemic manifestation, the most common serious systemic complication is the autonomic storm. The autonomic storm is a hallmark of systemic inflammation caused by scorpion sting. The venom, the action venom delays the closing of neural sodium channels, leading to continuous nerve stimulation and excessive release of neurotransmitters like adrenaline, noradrenaline, and acetylcholine. This results in mix of sympathetic and parasympathetic overactivity. We have two phases in the systemic manifestation of autonomic storm: the sympathetic and parasympathetic signs. The parasympathetic stimulation is initial phase, but the sympathetic stimulation is prolonged phase. For parasympathetic stimulation, we can see vomiting, profuse sweating all over the body, salivation, priapism, bradycardia, hypotension, premature ventricular beats. The parasympathetic phase usually lasts within 1 to 2 hours. So it is initial phase. For priapism, can be happen due to stimulation of natriuretic nerve that supplying benign smooth muscle leads to vasodilatation. The prolonged phase is the sympathetic stimulation. We can see tachycardia, hypertensive crisis, pulmonary edema, anxiety, cold extremities, mydriasis, and hyperglycemia. For systemic manifestation, we can start with pulmonary manifestation. We can see dyspnea, bronchuria, pulmonary edema, and respiratory failure. The pulmonary edema develop within 30 minutes to maximum 36 hours. Clinically, pulmonary edema can be suspected when respiratory rate increased up to above 24 per minute, orthopnea, basal rails, central cyanosis. CNS manifestation, we can find classic rotary nystagmus, blurred vision, difficulty swallowing, combined with excessive salivary secretions, may lead to respiratory failure. We can see also seizure, cerebral infarction, cerebral thrombosis, hypertensive encephalopathy. For metabolic manifestation, we can find hyperglycemia, metabolic acidosis, hypokalemia. Cardiac manifestation, bradycardia, tachyarrhythmia, myocarditis, hypo or hypertension, cardiogenic shock. GI manifestation like nausea, vomiting, abdominal cramps. We can see also find DIC. On basis of clinical manifestation, scorpion inflammation is graded into 4 grades. Grade 1, moderate to severe local pain at sting site, mild local edema without systemic involvement. Grade 2, we can find tachycardia, hypertension, agitation, and anxiety. Grade 3, pulmonary edema, hypotension, cardiogenic shock, cranial nerve dysfunction. Grade 4, multi-organ failure, coma, warm extremities. This is called warm shock due to decrease or absent peripheral vascular resistance. The next is the investigation. ECG may show sinus tachycardia, ST segment depression or elevation, BVCs, complete heart block, but it is rare. VTAC, marked tinted T wave. The tall T wave may mimic acute myocardial infarction. For laboratory, grade 1 and 2, no need for lab studies. For grade 3 and 4, labs recommended in moderate to severe cases or where systemic involvement is suspected. CBC, maybe leukocytosis may be present. Electrolyte and renal function test monitor for sign of acute kidney injury, hyponatremia, or hypokalemia. For liver enzymes, to check if there is hepatic injury or not, blood glucose for hyperglycemia, it is common due to sympathetic stimulation. Cardiac enzymes like troponin, CKMB, elevated in myocarditis. We need also VBG to evaluate acid-base status and detect respiratory failure or lactic acidosis. For imaging, chest X-ray useful to detect pulmonary edema, and echo recommended in the patient with suspected myocarditis. For medical management, scorbun intervention require a systemic approach based on severity, time, sensing, patient age, and comorbidities. Patient with suspected scorbun sting is to apply ABC principles and quickly identify signs of systemic toxicity. Airway, we must assess the secretions, stridor, laryngeal edema, or altered mental status. Breathing provides supplement oxygen. In severe cases like respiratory distress or pulmonary edema, consider non-invasive ventilation or intubation. For circulation, monitoring blood pressure, heart rate, capillary refill, establish IV access. For symptomatic and supportive therapy, the pain management, we can use local infiltration with lidocaine to sting site is effective in many patients. Paracetamol is the first line for mild pain. Oral non-steroidal like ibuprofen for moderate pain, but we must avoid the non-steroidal in hypotensive or dehydrated patient due to risk of renal injury. We can use also short-acting intravenous opioid like fentanyl for severe pain. For wound management, cleaning of the sting site, tetanus toxoid. The incision at the sting site or tourniquet is not advisable. For sedation and seizure control, we can use benzodiazepine like metazolam or diazepam for severe agitation, tremors, or seizure. Titrate slowly to avoid respiratory suppression. Phenytoin may be added in refractory seizure. Antivenom therapy. The mechanism of antivenom therapy, or the mechanism of antivenom action. The antivenom contains specific fragment of IgG which bind and neutralize venom toxin and helping to remove the toxin from the target tissue and eliminate it from the body. The indication of antivenom, it is indicated in those patients with significant systemic manifestation like persistent and severe hypertension or hypotension, pulmonary edema, altered level of consciousness, seizure, priapism. The dose, the test dose 0.1 ml intradermally. The dose is 5 vials antivenom IV diluted in 20 to 50 ml in half mixed with half normal saline over 30 minutes in adult. In the children will be give the same dose of the adult but dilute in 0.25 normal saline in infant and children up to 6 years. The antivenom could be repeated up to 4 doses every 1 to 2 hours till toxin manifestation disappear. Antivenom is most effective if given within 2 to 3 hours from sting time, but may still help if given within 6 hours. Medication like epinephrine, corticosteroid, diphenhydramine, and equipment for resuscitation should be available in cases of hypersensitivity reaction to antivenom. Cardiopulmonary support, ECG monitoring. The patient with pulmonary edema or cardiogenic shock should be treated with usual supportive care, like upright position, oxygen supplement, intravenous loop diuretics, oral prazosin. I will explain the mechanism of prazosin later. This is the first indication for prazosin, the pulmonary edema due to cardiogenic shock. The other indication of prazosin is hypertensive crisis. Massive pulmonary edema may also require immediate sublingual nitroglycerin, 0.3 to 0.4, or IV, 10 to 20 microgram per minute. In the patients with persistent hypertension, despite good analgesia and antivenom, we can use prazosin also. This is the second indication, hypertensive crisis. The mechanism of prazosin, it is alpha-1 adrenergic receptor antagonist. It reduces preload and left ventricular impedance without causing tachycardia. It is reverse the excess of catecholamine and inhibit sympathetic outflow in the CNS, lead to control blood pressure. The dose orally 250 to 500 microgram per kg in the children and 500 to 1000 microgram per kg in the adult, and should be repeated every 3 hours until the signs of clinical improvement appear or till dry or cold extremities persist. In scorpion sting patients, avoid beta blocker for hypertensive because it is stimulate alpha adrenergic effect. Blood pressure should be closely monitored and maintained at level of 90/60. Intraop support like dopamine and dopamine with dose 5 to 15 microgram per kg per minute as needed. For fluid and electrolytes support, transient initial hypotension is due to first hypovolemia related to excessive salivation, sweating, secondary to acetylcholine excess, or due to hot climate in the summer months, should be corrected by intravenous crystalloid, like normal saline and ringer lactate. And electrolyte imbalance should be corrected. For monitoring and supportive care, continuous cardiac monitoring, urine output monitoring, the target more than 1 milli per kg per hour, serial VBG or ABG, VBG enough, and lactate to assess perfusion and respiratory status. All stable patients should be observed for 4 hours to ensure no further progression of symptoms. ICU admission for patients with respiratory, cardiovascular, or neurological compromise, those patients need ICU admission. There is no evidence to support the routine use of steroid. This is practice is not recommended. For differential diagnosis, we have many differential diagnoses. Like snake bite, spider bite, acute abdomen, organophosphorus poisoning, anaphylaxis, allergic reaction, myocardial infarction, and phenochromatocytoma crisis and tetany. In the snake bite, the difference between the snake bite and scorpion sting, in the snake bite may cause ecchymosis in the site of the sting. In the spider bite, we can see muscle rigidity, but bite site often painless initially. For anaphylaxis, the difference, the anaphylaxis, rapid onset, hypotension, generalized urticaria. And tetany, due to hypocalcemia, the difference, we can see positive chophostic and troso sign in the tetany due to hypocalcemia. Discharge criteria from ER, no systemic symptoms, stable vital signs for at least 4 to 6 hours, normal physical exam, including mental status and breathing, normal ECG, normal labs, discharge education must be provided, including the red flags, warning signs, and follow-up instruction. The last slide, the conclusion. Scorpion sting are a serious issue in Saudi Arabia. Most cases are mild, but children are at high risk. Key to successful management, early recognition and triage, prompt supportive care, timely antivenom, close monitoring. Education, training, and antivenom availability are essential. Thank you.